Hello and welcome to Junior Achievement's Career Speaker Series. Today I am talking with Dr. Beth Ryder from Brown Surgical Associates. My name is Erin Cheschi and I am the Director of Community Partnerships and Programs with Junior Achievement. Welcome, Dr. Ryder. Please introduce yourself and tell us what you do for a living.
Hi, everybody. My name is Dr. Beth Ryder, and I am a general surgeon. I work at the Miriam Hospital and the VA Medical Center in Providence, Rhode Island.
So, why did you choose to be a surgeon?
Oh boy. I guess to kind of really talk about that properly, I got to really back way up, right? So when I was in middle school and high school, I really liked science. And that was probably my favorite subject, although I liked a lot of school, which is a good thing to like if you're going into medicine because there's a lot of school ahead of you. So I really liked science. And then I went on to college. And again, I majored in biology and wanted to combine my love of science with doing something really face-to-face to help people. And so then I went on to medical school, which is another 4 years after college. And while you're in medical school, you get to try on a lot of different types of doctoring. You know, I was lucky when I was younger. I had never really been sick, so I'd really only gone to the pediatrician. But you see, there's lots of different types of doctors you can become. And surgery was the field that I liked the most. Operations are really a very hands-on way of helping people. And I really liked that. And so that's what drew me to surgery.
What does your typical day-to-day look like?
Oh boy. So I have a job that's in academics, meaning I have patients and I see patients some of the time in the office. And I also do surgery in the operating room some of the time. And then I also have teaching responsibilities for other doctors that are training to be surgeons, as well as medical students. So I do a lot of different things any given day. And it's kind of, part clinical, meaning partly taking care of patients and partly teaching other people how to take care of patients.
Yes. And I know in your role on the education side, you really enjoy working with the students and teaching them. What is something that you love about your job?
The teaching part is easy to love, right? Because, I finished my training about 15 years ago. So I've been doing this kind of work for about 15 years. And a lot happens in medicine. It's a very dynamic field. And part of what I really like about the education component is that you're always learning new things from your students. So just as you're teaching students, you're also learning new things. I think that's part of why everybody likes teaching. No matter what kind of teacher you are, it really helps, it really helps you learn more about what you're doing as well. Keeps you fresh. And the students often have really interesting new perspectives. They're a lot younger than me now for the most part. And so I really enjoy, trying to keep it fresh, keep my skills sharp.
That's right. Continual learning in different formats and learning from students as students are learning from you is a great way to explain things. Now, switching gears a little bit, you said that you've always loved science. What was your first job and how did you get hired?
Oh boy. So again, my first job had very little to do with science. So I worked, really when I was back in middle school and high school, I did a lot of babysitting. My first real deal job was actually in a hair salon. I was the person that swept the floor, swept the hair clippings, and I ripped foil strips for highlighting. And I used the cash register. I confirmed appointments, all sorts of things like that. It was a really good first job. They were so nice and so helpful at teaching me those kind of skills. It was fun.
So, what was one lesson you took from that job that you still use today?
I think one really good lesson is that no matter what you're doing, you should take pride in what you're doing, right? So you can be any job you want, but you want to be the best whatever that you can be in that job. So, it's hard at first when you're answering phones and you maybe aren't sure of the answer, and trying to learn how to communicate better with people so that they're confident that you can eventually get the answer to your question, or, you make mistakes all the time, right? And if you're not experienced, and it's okay to make mistakes, but you really want to learn from them. And you really want to show the people you're working for, that you're trustworthy, you're going to learn from your mistakes, you're going to try to, you're sweeping the hair clippings, you're going to sweep the best hair clippings you possibly can, because that's your job and you should take pride in your work, no matter what you're doing.
That is such an important message to give to young people, to really hear that, no matter what you're doing, take pride in what you do and grow and learn from it.
Yep.
So
It's incredibly important. And it really doesn't matter what your job is. You want to be the best, whatever that is, you can be. It's very personally satisfying. And, there's nothing better than trying to do your best.
That's right. And what did you want to be in middle school or high school when you grew up?
Yeah, it's hard. It's funny you should ask that question, because I think I actually wanted to do something. I had maybe teaching. I had always thought about teaching. I had a really great dentist when I was little, and at one point I really wanted to be a dentist. But then I decided the mouth wasn't really my favorite part. So eventually I broadened out to medicine.
And sharing that, can you share your career and educational journey and something surprising along the way?
Yeah, so as I mentioned before, it takes a lot of school to get to be any kind of doctor, and I really liked school in general. So I think that's probably the first thing about my journey, is I've done a lot of school, right? So after high school, there's 4 more years of college, 4 more years of medical school, and then multiple years of training before you're done. I think one thing that surprised me when I was in my medical training is, I think when you're at the beginning, you look ahead and you think you have an idea of what the person at the end is going to be doing. Oh, they're on easy street, they have all these people under them helping. And then you get to the end and you realize that part of being done with your training is also understanding how everyone else's job is done. So you're really still doing a lot of the same tasks with the assistance of other people, and making sure that your whole team behind you is kind of on your toes. That definitely surprised me, that as you move forward, you still have to really keep in mind the day-to-day tasks. And I don't think it's easy to see that from the start. I hope that makes sense. Did I explain that well?
Yes, you did.
Okay.
And touching upon, not being able to recognize those tasks that somebody has to do as a medical doctor when you're a student, what do you suggest for students to do to understand that and realize that?
That's a really good question. And I think TV is definitely not the answer, right? There's a lot of medical dramas on television, and that is definitely not what my life is like for the most part. I think any kind of opportunity for shadowing is helpful. I think trying to just do your best in school is helpful, and then that'll open doors for you. I think those are probably the best suggestions.
And is there any education or training certifications that you need to acquire and maintain in your profession?
Yes. So even when you're done with the 4 years of college, 4 years of medical school, multiple years of residency, you still have testing that you have to do to stay certified. Actually, one of the real nice things about being at Miriam within the Brown General Surgery residency and department is that a lot of our continuing medical education or our lifelong learning is provided through the hospital itself. So there's presentations that I go to weekly, again, where I'm continuing to learn new things, continuing to keep my certification up so that I'm taking the best care of people as I can.
And I think that's an important point to make, for students that are considering going into the medical profession. recognizing that it's continued learning and education. Even when you become a doctor, you never stop learning. So you stay on top of all the modern technologies and information.
And the field changes a lot, like many fields. I mean, I think many fields you're not done at the end of school. You're going to keep reading, keep learning. These days there's so much technology. You can watch videos to get educated. But yeah, learning is a lifelong thing. Definitely in medicine, learning is a lifelong thing because things keep changing.
That's right. And you recently have been promoted. Congratulations, by the way.
Thank
And can
you.
you share how you were able to get into this position, your recent promotion?
Yeah. My current position is the director for the Center for Bariatric Surgery at Lifespan, centered at Miriam Hospital. And bariatric surgery, for those of you who don't know, is surgery to help people lose weight. And the position involves coordinating care for the patients, and making sure that we are looking at how the patients do, in order to be sure that we're providing good care for the patients. You basically get to roles like this by spending time in one particular institution, and then when a vacancy comes up, when the position becomes available, you apply for it, and sometimes things work out. But it's basically a coordination. It doesn't necessarily change what I do in my daily practice of taking care of patients in the office and the operating room and teaching students and residents, but it does have an extra layer of responsibility for coordination of the care in conjunction with a ton of really wonderful people at Brown Surgical Associates and the hospital. It takes a real team to do good patient care, and I'm super fortunate that I have some really wonderful colleagues, doctors, dietitians, nurses, the support staff at both places. It takes everybody. So you're kind of helping coordinate all of that in my role.
Yes. And Dr. Ryder, I know how humble you are, and I know how hard you work. So you definitely deserve the position and the promotion because you are a very dedicated surgeon and you do care about your patients. So again, congratulations on that. And I have two last questions for you. The first is, what advice would you give to your younger self along with young students?
My younger self. Keep going. I think sometimes, you're in a class and you don't really like it, or you don't really see how it's going to get you to where you need to go. Just keep on going. And, hard work is usually celebrated.
Thank you. That is a great answer and some great advice for young students. And my last question for you is, are there resources or any additional information you think is important for students to know if they are interested in a career in medicine?
Yes, I think that if you're interested in a career in medicine, definitely by the time you get to high school, there's going to be some great resources through your guidance counselors on what programs are available. There's a lot of things to do in medicine besides becoming a doctor. There's many, many, many careers available, and it's a growing field, and there'll always be a need for healthcare professionals. So I would definitely reach out to your guidance counselors, any kind of advisors that you have when you hit high school, and they can sort of tell you about the available programs that are around that you might, want to arrange your schedule such that you would be qualified for when you're done.
Thank you so much. That is some great advice. I remember when I was younger and I thought about becoming a doctor, all I thought about was there's so much school and just got so overwhelmed. So it's great to know that there are other positions available within medicine and those resources that are available, and really talking to guidance and understanding what it would take.
Yeah. I mean, I don't have any parents that are doctors or, doctors that I knew particularly well before I was in medical school, so it's definitely a field where you can just jump right in.
Well, thank you so much for your time, Dr. Ryder. I greatly appreciate it. And I'm sure the students will appreciate this interview as well.
Excellent. Happy to do it. It was a
Thank
pleasure.
you. It was a pleasure too. Thank you.